Vance Harris, and today I'll be performing my secondary assessment for Lab 1. So after completing my primary assessment and making sure that my patient is okay, I would then move on to performing my sample assessment and then my secondary assessment after that. So the first part of my sample assessment is determining any signs and symptoms. So I'd be checking for bleeding, obstructed breathing, or any other signs of distress, like on the patient's skin, for example. So I know that there's no blood around the patient. I checked and already determined that her breathing was normal and not distressed in any way, and then her skin was also free of signs of an injury. So after that, I then asked my patient if she has any allergies, either to medications or to things such as bees or foods. So, do you have any allergies to medication?
No.
Any food allergies or anything like bees or pollen?
No.
Okay. After that, I would then determine her medical history to make sure that she doesn't have any family history or previous conditions that may have affected and caused this medical event. So, do you have any previous medical history that may have caused this accident?
No.
No? Do you have any family history that could have caused this either?
No.
No? Okay. Lastly, I would check to see the last time that she has eaten or drank anything, as that could have also affected this. When's the last time you had something to eat or drink?
Like an hour ago.
Okay. And then finally, I would ask what events led up to this accident to determine what may have caused it. What happened before you fell?
I was running
You
around.
were running around, you tripped?
Mm-hmm.
Okay. So after completing my survey sample and getting background information on my patient, I would then move on to performing a full body examination to determine any other factors that may be affecting my patient or to see any areas that she may be in pain. And this is from head to toe. So I'll start at her head and work my way down to, through her full body to complete the assessment. I would start with the DOTS acronym, so deformities, open areas, tenderness, or soreness. So I observe that she has no deformities or any open areas or open wounds on her body. So then I would now perform the physical examination to determine any sore or any swelling or tender areas. So again, I would begin at her head and neck, feeling for any signs of pain. Are you in pain at all?
No.
No? Okay. I would also check her eyes to make sure they're reactive to light. Her pupils are, in fact, reactive to light and are equal in size. I would also check to see and make sure there's no fluid draining from her mouth, nose, or ears that would indicate leaking spinal fluid, which I don't observe, which is a good sign. I would then move on to checking her shoulders and her chest, pressing on her ribs to see if any of them are broken, and I would also check to make sure that her trachea isn't deviated at all, indicating a punctured lung. I don't observe any of that, which is a good sign. And then move on to pressing on the 4 areas of her abdomen. Does this hurt at all?
No.
No. Since there's no pain, I do not need to perform the reflex test. I would then move on to checking her arms, as well as her hands for any signs of pain, and would once again check capillary refill, which I do note as normal. Finally, I'd move to checking her pelvis. Any pain?
No.
Again, no pain, and then move on to checking her legs. I'm gonna ask her if the sensation in her legs is the same, because if it's different, that can also indicate some kind of injury. Do you have the same feeling and sensation in both your legs?
Yes.
Okay. Lastly, I would again check her capillary drain, this time in her toe, to make sure it's normal, like her fingers, check, and it is indeed normal. Lastly, I'm going to ask her to turn on her back so I can check that for any signs of injury, as well as get her into the recovery position so that it is easier to transfer her when the paramedics arrive. Here, can you bend this knee for me? I'm gonna have her bend her knee and then turn on her back so I can continue my examination. Any pain?
No.
There's no pain in her neck or back.